Welcome, everyone. I am Dr. Belinda Jordan, and today I want to make it a little easier to navigate through open enrollment and choosing the best medical insurance option for you and your family. How can you get health insurance? Well, number one, if you're employed, your employer may offer you one or more plans for you to choose from. You can purchase your own medical insurance plan through the Affordable Care Act on the Marketplace website. If you're 65 or older or disabled, you may qualify for Medicare. And certain low-income individuals and special populations may qualify for government programs such as Medicaid or CHIPS. Now let's look at when you can get health insurance. That's going to depend on where you get it from. You can sign up for a new plan or change plans following certain qualifying life events. Life events are starting a new job, or if you lose coverage, such as maybe leaving your job, or if you are no longer covered under your parents' plan, or maybe you no longer qualify for a government program such as Medicaid or CHIPS. You may also qualify for a change in insurance if there's a change in your family, such as a marriage, divorce, death of a spouse, or the birth or adoption of a new child. You may also qualify if you move to a different zip code or a different county, or if your income changes enough to qualify you for a government program. Lastly, if you turn 65, you now qualify for the enrollment period for Medicare as well. Now, once you have insurance, you can only enroll or change your insurance plan during special enrollment times called open enrollment. These enrollment periods are usually only once a year, usually during fall, and vary depending on where you get your medical insurance from. If you get your medical insurance through your employer will decide on the window of time when you are able to change your plan, and it's usually during the fall. If you are getting your insurance through the ACA Marketplace, open enrollment will start on November 1st and ends January 14th. If you are on Medicare, your time to make those changes started October 15th and it runs through December 7th. Now, if you miss these windows, you may not be able to make any changes until next year unless you have one of those qualifying life events we just talked about. You can choose insurances, but if you don't know the terminology, you're not going to know what to choose or what you're looking at. So terms to know. You hear the word networks. Networks, every insurance company has a network of providers who they contract with to provide services that people who have that particular insurance plan can use. Depending on the type of plan you choose, you may be restricted to seeing only in-network doctors. Other plans may allow you to see other providers outside of the network or out-of-network doctors at a higher out-of-pocket cost. Insurance plans may differ based on what doctor they allow you to see, or whether you can refer yourself, or if you need your primary care doctor to refer you. A health maintenance organization, or HMO, is the most restrictive type. You must have an assigned PCP who manages all your referrals. Referrals can only be made to other in-network doctors and must be pre-approved by the insurance company. Out-of-network coverage is usually not covered. A preferred provider organization, or PPO, is the least restrictive. You can see any provider in the network without a referral. You do not need an assigned PCP, and you can see some out-of-network doctors as well. There are some hybrid plans that fall in between an HMO and a PPO. An exclusive provider organization, or EPO, is similar to a PPO, but it does not cover out-of-network providers. A point-of-service plan is similar to an HMO, but to pay the lowest cost, you need to choose a PCP and get referrals to in-network providers. But you do get the option to see out-of-network providers as well. So, important points. HMOs are the least expensive, but the most restrictive plans. PPOs are the most expensive, but the least restrictive plans. EPOs and POS are somewhere in between. But perhaps the most important thing to keep in mind when deciding is making sure that the doctors and the facilities that you want to use are in network to keep your costs down. Now let's look at terms related to what it's going to cost you. Your premium is the amount you pay for your insurance plan each month, whether it's through your job or the marketplace. On the marketplace, your premium may be offset by a government subsidy depending on your income. Your deductible is the amount you must pay before the insurance plan starts to pay. This will be listed as an individual and even a per family deductible. Some services, such as preventative care visits, may be exempt from this. Out-of-pocket max is the most you will pay for services under the plan. Once you reach this amount, you no longer have to pay anything else out of pocket until the next calendar year. Allowed amount. This is the amount that the insurance plan has negotiated with the provider to pay for the services provided to you. In-network providers have agreed to this amount and should not bill you for the difference. However, if you are using out-of-network providers, they are allowed to charge you the difference. Now, cost sharing refers to the amount that you're going to pay toward your medical services. This may include your deductible, your copay, or your coinsurance. A copay is a fixed amount. It's a fixed fee you pay every time you visit the doctor. It may be higher for specialists compared to primary care doctors. Your coinsurance is a percentage of the allowed amount that you yourself are responsible for at the time of visit. Now let's look at the breakdown of different insurance plans and what they offer. Now, this really refers more to the marketplace plans, but now more and more commercial insurances are using these tiers to basically describe the services within their plans. The marketplace and some individual insurances use these tiered systems to classify the plans. The categories are based on the cost of the monthly premium, the amount of the deductible, the amount of copay or coinsurance, and the cost of prescription medications covered. The tiers are bronze, silver, gold, and platinum. And we're going to talk a little bit about each one to kind of see what each one can offer. So first, let's look at the bronze tier. Bronze tier plans are usually going to have the lowest monthly premiums. However, your deductible amount will be the highest of all plans, often $7,000 or more. You will probably have higher copays and larger coinsurance amounts, and some plans will not cover any office visits, labs, imaging, or any other services until you have met the deductible amount. Additionally, prescription medications may be very limited or not covered until that deductible is also met. These plans may be best for people who are pretty healthy and don't utilize healthcare services very often, or simply want to have a just-in-case type of plan, maybe for emergencies or hospitalizations. Silver tier plans are priced slightly higher than bronze plans, and deductibles are moderate. Average may be between $2,000 and $6,000. Copays and coinsurance are usually high, with specialist visits being most affected. Office visits, labs, and other services may not be covered until the deductible is met, but that deductible is now lower and easier to meet. They may also have better prescription coverage, but copays and coinsurance may still apply. These plans are good. These are a good choice for most people who may see specialists every once in a while, may have some medical conditions that require frequent follow-ups, or who take medications on a regular basis but don't want to spend too much money on the monthly premium. Gold tier plans have the highest monthly premiums, but very often they also have the lowest deductibles or zero deductible. Copays and coinsurance amounts are also pretty low, and prescription medications are covered at little or very low copays. These plans appeal to people who have multiple medical conditions and frequently see their PCP and other specialists. People on brand name medications may also benefit from the lower pharmacy costs. Platinum plans are advertised to have the best coverage, but they also have the highest monthly premium. As of right now, no company offers platinum plans in Texas, but this may change after the marketplace officially opens, so check back after November 1st. So now let's look at how these plans compare to each other side by side. Here we have 3 different plans, and as you can see, the monthly premium is the least in the bronze plan. It is also more restrictive with its provider network since it's an HMO. The deductible is quite high at $7,400. This particular plan has a zero copay for PCP visits, which seems great, but if you read the fine print, that applies only after you have paid that $7,400 deductible. The silver and gold plans offer more provider options since they are EPOs. They cost more per month, but the deductibles are lower. The gold plan covers PCP and specialists for a flat fee, which is good if you see specialists on a regular basis. Now, here's where it gets a little more complicated. Medicare, like I said, Medicare, we could do an entire hour on just Medicare and all of the different plans that they may have to offer. But we're going to just kind of talk about the basics of Medicare. Now, traditional Medicare is divided into two parts, Part A and Part B. Part A covers inpatient care, such as hospitalizations, nursing home care, hospice. Part B covers outpatient care, such as your doctor's visits, imaging services, laboratory. If you have traditional Medicare, you can see any Medicare-approved provider without a referral. However, prescription drug coverage is limited. You can purchase a separate prescription plan called Part D to cover your prescription medications. Benefits are limited to medically necessary services, so there's no dental, no vision, no yearly physicals. In addition, you pay a portion of your medical bills through a monthly premium, deductibles, and coinsurance. Now, during Medicare open enrollment, you can exchange your traditional Medicare plan for a Medicare Advantage plan offered directly by commercial insurance plans such as Blue Cross Blue Shield, United Healthcare, Ambetter, and others. You may get additional services, including prescription drug coverage, dental, and vision, but the downside is that you must stay within their network of providers. You can find Medicare Advantage plans through insurance providers' websites, or you can seek assistance from an insurance broker to help you find the right plan. However, some brokers do get a commission for signup, so it's best to look for an independent broker who can lead you to the right coverage without a bias. Now, most important, before finalizing any change in insurance, you should always check with your current providers and your facilities that you use before switching to ensure that they are in network with the Medicare Advantage plan you are considering. If you happen to change plans and your providers do not accept that plan, you will be forced to find providers within that network. Now, for many people, health insurance just ends up being too expensive. There is one more option that helps a lot of people get the care they need at a price they can afford. Direct primary care is a membership-based model of providing primary health care. You pay a flat fee per year or per month that covers most of the services provided by your primary care doctor. There are no deductibles, no copays, or coinsurance to worry about. Another great benefit of the direct primary care model is that the focus is on you. You get real one-on-one time with your doctor in a relaxed atmosphere. They often offer things like same-day appointment, next-day appointments, longer visits, and even after-hour visits when you really, really need them. So who should consider direct primary care? Really, there's two populations that I think are well-suited for direct primary care. If you can't afford health insurance or the monthly premiums are way too high, or if you chose a plan that has a very high deductible and you really know you're never going to get enough medical services to reach that deductible, it may be something you want to consider as far as a flat fee and choosing a less expensive plan with a higher deductible. I like to call those kind of like just in case plans. In case something bad happens, you have some coverage, but your regular primary care is completely covered. Other people that may want to choose direct primary care are people who are specifically looking for that better patient-doctor relationship. So we have our clinic. It is called Jordan MD Elite Primary Care. We do offer direct primary care services for people who have either very high deductible plans or who have no insurance for a flat monthly rate. You can visit our website here and learn more about the services that we provide. No problem. Thank you for joining me today. And like I said, if you have any other questions, feel free to either email us or contact us directly through the website.
All right.